The need for healthcare innovation has never been more pressing. By the year 2021, national health spending will account for nearly 1/5 of the U.S. economy. Delivering affordable care demands a dramatic shift.
And push against me here.
Traditionally, a doctor gives advice and the patient and family takes it or doesn't. As the healthcare system struggles to transition, the doctor-patient relationship must become an active partnership.
That's where the pain gets burned out right now.
You're not feeling it right there. Yeah.
Patient engagement is not a new idea. Consider the effect of the internet. Patients and parents often arrive at the doctor's office having read up on their condition. The information may or may not be reliable or relevant. Over the next few years, innovation in technology will open a world of possibilities. Apps and other online tools will be specifically designed to educate and engage consumers. Some innovations are being piloted at Boston Children's Hospital, including web portals.
Does anything hurt today?
And robots, changing the way doctors and patients interact.
Hi, guys.
Incorporating new kinds of communication into the doctor-patient relationship isn't without challenges. It requires a cultural shift among providers, some of whom may resist change. Integration into current workflow will take time. Issues of privacy must be attended to. And will all patients and families want to or be able to use technology? Engaging patients requires more than new kinds of digital communication.
We need patients and families to tell us their needs when it comes to proper management of their conditions. To do this, we need them to become engaged and empowered in all areas of healthcare, including governance, clinical care, and research.
There's ample evidence that patient engagement can lower costs and improve outcomes. But substantial investment is needed to determine which approaches will pay off the most for both patients and the healthcare system.
So there you have an outline of the problem and the challenges ahead. So I'd like to ask any of the panelists who care to answer, what do you think are the implications of the ACA for the patient experience and patient engagement?
There's an organization called PCORI, which is very relevant here. It was created under the Patient Affordable Care Act, and it's Patient-Centered Outcomes Research Institute. And there, the idea is actually to engage patients for the first time in helping us to create this learning health system and figure out, with data, how therapies can improve, comparing one therapy to another, and understanding the outcomes that are important to patients. Because it may be the case that we've done the clinical trials and we've figured out how to tweak some molecule in your blood so that the level is a little higher or a little lower, and we declare victory as soon as we get that done. But what the patient cares about is, did my child get back to school? How many days were they able to breathe comfortably when they had asthma? And those are the patient-centered outcomes that we maybe haven't paid as much attention to. And so that part of the Affordable Care Act is actually a well-funded and very sharp focus on those issues.
So that old paradigm of the patient being advised, and we hope that when they go from provider to provider as they get referred for different types of care, make sure you have that bag of prescription bottles in your hand so that they know what you're taking, is now going to be transformed into the subject of data that patients have access to know what treatments you've gotten, what follow-up you're required, to be able to have a role in your own care, coordination of your own care.
What do you see as some of the biggest problems with electronic medical records, and how would you address those issues to give patients better data?
There's an assumption out there by the public that we in the hospitals know our outcomes, we know our data, and now we have an EMR that makes that even easier. Well, the truth is it actually makes it harder in many ways to get that personalized attention. A lot of providers spend, especially in the ramp-up phase, so much more time trying to figure out where to put the data in. They move to templates, so you kind of have a sterile report of your patient encounter. So we don't necessarily get the experience of every single person. And I know for me, when I bring my child in, that person counts, and I don't want that person to be the outlier that doesn't count. Accounting for every single child is not happening with an EMR right now.
If we take some of the major disorders that we have out there, like multiple sclerosis, and you go into an EMR record, how often does the physician capture EDSS scores, right? That's actually our measure for efficacy. You can't get a drug approved without looking at EDSS, but you can't find it in the EMR record when you go in the real world if you want to know what drugs are working and for whom. And then you tack onto it all the other measures that are related to effectiveness, not just efficacy, because are you reducing hospital visits? Are you somehow improving the whole quality patient experience? And we need to find a way to actually capture all of these clinically relevant measures. But also, it's also education, right? Like, you know, as part of your duty as a physician and as a patient as well, is to make sure that your data does get in there somehow. So it's about changing behaviors as well.
The administrators who run these systems often don't really have the incentives, and that's a problem, right? If you can't convince the administrative side of the hospital system that measuring outcomes matters and is relevant and drives something positive for them and their business, that's an issue.
Questions from the audience?
I really appreciate the ability to be able to go and kind of understand better the decisions that my physicians might be making, but that there's always a temptation to kind of try and see if you think they're making the right decision. So can you talk a little bit about, I guess the extreme is you know, an environment where patients kind of decide what treatment they want and are going to try to find a physician who will do it. Can you talk a little bit about how you'd prevent something like that?
We've got to move to where patients are engaged as a partner in the team for healthcare. So many times in my experience, families bring so much more perspective of what's going on with their children, and you've got to consider the opposite, where I've experienced doctors that were wrong a lot. And not that I don't love my medical colleagues, but the mother who knew every step of the way what should have been done and guided their hand. So all I'm saying is they offer a really important voice, and so it's a partnership and a trust that's built, but the information has to be transparent to start the conversation.
There's also a spectrum of sensitivity around sharing knowledge. So if you're talking about bipolar disorders versus, you know, metabolic syndrome, you know, there might be some vanity issues, but when you get to that end of the spectrum, bipolar, people don't necessarily want to share, and we have to put systems in place to kind of handle that.
Right.
We're not just talking about provider-generated data, but also health insurer-generated data that patients would find very useful and able to have. Remembering when your last whatever service was, matching your explanation of benefits to a statement, et cetera.
I'd like to try to drive us back to the question at the top of the page there that says, it's your health, why aren't you in charge? And I'd love the comments from the panelists on my somewhat provocative statement. I have an MD, but I'm going to wear a patient's hat, and I'm going to say that there is a culture of making patients second-class citizens, and I'll drive down on one particular example. I'm reading from the Massachusetts All-Payer Claims Database, which is comprised of medical, pharmacy, and dental claims, as well as information about member eligibility, benefit design, and providers from all payers covering Massachusetts residents. So that's a database of all of the costs and claims in Massachusetts. When I was at Massachusetts General Hospital, I was able to access that all payers claims database. As an individual patient, I don't have access to that information.
Going from sort of 0 miles an hour to where we're going now, tools for physician compare, hospital compare, nursing home compare, I mean, those actually probably would have some elements that might be relevant and a lot more useful than nothing, which has previously been available in past years for patients to make quality-based decisions based on quality and to have that kind of information. I'm not sure, so your point is well taken. I mean, that's another source of data that is not available at the individual patient level, but rather at the provider and institution level.
Patients aren't always happy with the answers they need to hear. Yeah. In fact, you get a lot of dissatisfaction, then you go doctor shopping. So how are we going to measure engagement, which is what I think we want, versus satisfaction, which is, you know, how good is the hotel?
Patient satisfaction sometimes, you know, with how those surveys are done, sometimes they don't really even get at satisfied patients. And I don't know if we always understand what's really a satisfied patient or an engaged patient, because we don't always spend the time to get them engaged and understand that. So I think part of what we try to offer in our service is not just data. And so we've talked a lot about data, and we've talked a lot about technology and algorithms that are very sophisticated. But a lot of people don't understand that, and I think getting them engaged means really making sure they understand what you're telling them, understanding the treatments, and that takes time. And that is a very scarce resource in healthcare now as well. So people are being pushed to see lots of patients, fill your beds, and do all of this, and turn around. So even though they can't stay long, fill that bed. And that puts a lot of pressure. So I'm not sure, I think to engage families and patients, you have to spend time with them. And we as a health system need to make sure we're giving our providers time, and that's nurses as well. That's not just physicians. And I think our team approach could be a lot better with that as well. And frankly, there are other people who want to be involved in healthcare that maybe not professionals that could help with patient engagement. Just sit with them and talk and make sure they understand.
I'm wondering if any of you, and I think Ken, you have thought about using technology to develop medical applications to help patients manage their own health. And if you have, the FDA just issued these regulations yesterday to govern these, and I'm wondering what your thoughts are about the progress of these medical apps, how this affects it, what you all are thinking in that area.
It looks like they got it about right and are not going to try to do something like regulate every app that's developed, because the whole point about innovation in this app space and why we're trying to bring an apps model to EMRs is that these things are going to constantly evolve. They're really focused on the apps that are functioning a lot like medical devices, or that are actually supporting actual medical devices. And that's an area where you probably do want some regulation. How the FDA is going to manage that is another story. But I think they sort of left room for innovators to keep going, while also taking the opportunity to have the authority to go after an app that they felt was in some way causing adverse events.
I just wanted to go to the concept of medical home. Ideally, it's something where care coordination happens, people don't fall through the cracks, and it's a way to have preventative care versus putting a Band-Aid on things as they get to the sort of end stages. Where are we in the process, especially now that the ACA is coming up, in terms of pushing for that, like, to a medical home, reality?
Patient-centered medical homes, certainly again in that category of one of the earliest areas of really requirement and investment and encouragement for demonstration under the Affordable Care Act. So that, along with the accountable care organizations that we saw, the partnership for patients, the engagement between providers and patients, really focus on what's best for the patient, what's best value, best quality, not so much volume, not so much multiple providers who are not connected and not coordinating the care.
As part of our Texas Children's Health Plan, opened recently a Center for Women and Children, because as a health plan we saw the need to have a single place where women and infants can come to get care. We had a huge population, and it's kept them out of our main ERs downtown. They can get eye care, Well Women Health. And I guess I just think that's what we felt was important to do, and you have to do it, and it's a model. And as our CFO said, that is a model for improving healthcare, and you got to do it at the grassroots level. And as a plug for our group, we want to track those outcomes. So did we really improve? We do so much in healthcare without measuring performance, but it's important so that we can have evidence when we go to our governments, statewide especially, to say this did work. It saved us money, and our children are healthier over time. I think that's the other piece, is longitudinal assessment. Not just today, but is their quality of life better? Are the scores better? When we talk about behavioral health, are we measuring at each and every visit indicators that would tell us the outcomes of these patients? That's critical to building a good clinical program, is measurement. And that's how we think of it. Clinical programs partnered with outcomes measurement each and every time.